And to our next early investigator, Dr. Sara Pardej.
Yeah, that would be great. Oh yeah, no. Which one is the advance? The green? The big green? Okay. Yeah, that one. Thank you. All right. Hi, everyone. My name is Sara Pardej. I work with Dr. Plank and Dr. Green. I'm very happy to be here today, and thank you again for the opportunity to present my research. So I'm going to be focusing on academic achievement, so a little bit different, but related to what we've been hearing about all day, and especially within this session. So the brilliant researchers who came before me did my job for me and pretty much described all of these things, which is wonderful. But just to summarize, in Noonan's, we see increased likelihood of various neurodevelopmental concerns ranging from ADHD, autism, difficulties with executive function, oppositional defiant disorder. But the kind of missing link is looking at academic abilities. And the problem with that is in just the general population, when you have one neurodevelopmental disorder, you're much more likely to also meet criteria for another neurodevelopmental disorder. Yet academic abilities and especially specific learning disorder really haven't been investigated much in Noonan at all. So we know from both human and animal models that learning and memory in particular are affected. And learning and memory aren't necessary conditions for developing a specific learning disorder, but they certainly can contribute to academic outcomes and academic performance. So I think that there's, a lot of background research that points us to the fact that this is a very important domain to be looking at in this population. So I'm going to very quickly fly through the methods and results. There's a lot to get through, so please find me at my poster if you want to talk more. But here's a quick snapshot of our sample and who's represented. And just want to point to you very quickly that right off the bat, between our Noonan group and our unaffected group, there were significant differences at the group level in word reading abilities, spelling, and math. And here's a quick snapshot of which mutations were represented within our sample. So these are the measures that we used. Take home message here is that this was collapsed across 2 waves of participants. So the measures are slightly different, but still measuring the similar domains. So intellectual abilities, executive and attention abilities, as well as academic achievement, and specifically word reading abilities, spelling, and math. So I'm going to talk through results and key takeaways kind of one by one since there's a lot to digest here. So first, we were really interested in estimating what the prevalence of specific learning disorders may be in this population. So to be clear, this is not a clinical diagnostic clinic. So we were not actually diagnosing. But typically what happens in the process of diagnosing a specific learning disorder is administering one of these norm referenced measures and seeing where is the person falling in line with their same age peers. And there's not great, unfortunately, prevalence data, but the best estimate that we have from the DSM is that about 5% of the general population will meet criteria for a specific learning disorder, any kind. So we used a 5% estimate as a very liberal guess for each type of learning disorder. So in reading, in math, or in written expression, which for us in this case would be spelling. And we wanted to see whether in our mutation groups, was that going to be around 5%? Is it going to be different from the general population? And what we found was that across all of our different academic domains in each of our groups, PTPN11, SOS1, and other mutations as a group, the prevalence was significantly different and, as you can see, a lot higher than in the expected general population. So that's the values in the red there, meaning that those scores are falling in the below average range or lower. So key takeaways here is that all of our groups had significantly lower scores across these various academic domains. The prevalence, or again, estimated prevalence, is much higher than in the general population. And in particular, youth with the SOS1 mutation had the highest frequency of difficulties across all of these measured domains. So another thing that we wanted to look at was comparing the distribution. So quick history lesson in diagnosing specific learning disorders. This was kind of the model that was used for a long time. Is there a difference between IQ and achievement scores? And if there was a significant difference, then we would diagnose a specific learning disorder. Some practitioners and educators still use this model, but it's not necessary for a diagnosis. But in our case, we know that on average, youth with Noonan's tend to fall in the low average range of IQ. And so we wanted to see, okay, so then is it commensurate? Is IQ just commensurate with, are their academic abilities? And so typically we see, so this is literally a subtraction, IQ minus their score on word reading. And what we typically see is that there's a normal distribution. And in fact, we see that in our unaffected sample. And when we look at our samples of youth with Noonan syndrome, there's a lot of heterogeneity. So our only significant difference here was in our SOS1 group. So the PTPN11 group and then our other mutation group, those distributions didn't actually significantly differ. So this is for word reading. For math, we have a significant difference for our SOS1 group and our other mutation group, but not PTPN11 from the unaffected group. And finally, when it comes to spelling, again, SOS1 had a significantly different distribution, but the other groups did not from the unaffected group. So what does this mean? So these distributions varied a lot, and it also highlights the heterogeneity in cognitive presentations and the kinds of difficulties that youth with Noonan's are having. The SOS1 group did significantly differ and tended to be skewed left, meaning for a majority of the individuals in the SOS1 group, their IQ was considerably higher than their academic achievement. So the final thing that we were interested in exploring are these difficulties that we know are apparent in executive functioning and attention, are those really the driving factors for why these youth may be struggling with attaining these academic skills? So this was I'm going to kind of simplify this. This was two different sets of regressions, given that we had two different sets of measures for the different waves. But overall, the pattern of our findings were that working memory was a significant contributor above and beyond the effect of having Noonan's on reading, spelling, and math. Processing speed was a contributing factor for word reading and math, and inhibitory control was a contributing factor for math. So what does that mean? Executive processes do play an important role in academic achievement in youth with Noonan's, and that was pretty robust. We found these relationships across both of our waves of participants. And the variance accounted for was really significant. It ranged between 1/3 and 1/2. So that's quite a bit. And so in terms of implications, I'm really hoping the take-home message that you hear from me today is that we really need rigorous and frequent screening, both in educational but also clinical settings. A lot of things that I hear from families is that they really have to fight tooth and nail for these academic accommodations from school, but they're needed, and it's plain as day, and it's really unfortunate. And we need to be better advocates to make sure that they're getting connected with these resources. And in addition, executive skills may also be playing a contributory role and should also be addressed through interventions and should be considered as potential intervention targets in the future to help ameliorate academic outcomes. And that's it. So thank you. And yeah, we're recruiting for several research studies. So take a picture.
Thank you so much. Any questions? Yes.
Thank you for the great talk. So do you see any gender differences in any of your measures?
That's a great question. So in this sample, there were no sex differences, so I didn't include it in any of the models.
I don't think you measured this directly, but observations about the type of learning that students do with, with or without Noonan syndrome. Like, do you find that kids are more visual learners or kinetic learners, or I don't know if that model even holds anymore, but can you comment on that?
Yeah, so we're not necessarily capturing that in this data, but I know that in the human research that's been published, there's actually quite a mixed bag in terms of visual learning and verbal learning. And some studies show that it's not significantly different from unaffected kids. Some studies show that it is. So I think it's a little bit of a mixed bag and likely speaks to the heterogeneity that we're seeing. Yeah, and I think, I think that especially when it comes to things like academics, there's no one size fits all. And I think that that's why it's so important, not only for families, but parents to go, but also to bring your kids to things like IEP meetings so that they can advocate for the specific kinds of ways that'll help them learn and retain that information over time.
Thank you very much. Both of these talks have been absolutely exemplary structured. So congratulations to all the early researchers who've spoken so far. My question is sort of about a problem that we have in Britain that I'm sure we share with the US, which is that schools have got a package of tools available for people who have an underlying diagnosis of neurodiversity, autism spectrum disorder, ADHD. But once you've got a diagnosis of a genetic condition, they don't have a box with that label on it. And they have to take a more reactive rather than a proactive approach. To what extent are schools reacting to this research? To what extent are they feeding data in, and to what extent are they needing to learn? And are you finding that children are struggling to get those ADHD or neurodiversity assessments because they come with the diagnosis already? Because we're finding that certainly in the UK.
Sure. I think the extra complicating factor, and maybe this is similar to the UK too, but in the US, it's so based off of funding to specific districts, what resources are even available, and how much time an individual child can get with these resources. And I'm sure many parents have kind of had this experience where they kind of tick off boxes of like, oh yeah, we met these goals, we don't need them anymore. And that's not necessarily the experience of the child. So I think it depends on that. But also, I just want to speak to the fact that I've had, at least in the places that I've practiced across the US, Midwest, East Coast, West Coast, a lot of what I'm seeing is that the schools aren't even reacting to the diagnosis to begin with and are not initiating the process because they're like, well, we've never heard of that. So they seem fine in class. They're not causing any disruptions. So it's even that initiation. And sometimes once they're able to get to that IEP meeting, they can get something, but then you get to the resource issue that's location specific.
I do want to add to that from what we're trying to do with this line of papers is, and we have a good experience with another one, that we phenotype the psychiatric conditions in kids with Noonan, that we just instruct them to take the paper and give it to the education system. And we see really good kind of responses, especially because also in Sara's paper, there's the specific accommodations or specific recommendations. And I think it's exactly like with patients. Once the school know what it's dealing with, so it reduces anxiety and resistance. So I think this is the true significance of this work. Thank you.